止痛药英文怎么说？
Painkiller refers to a medication or remedy used to alleviate or reduce pain. Other words that can be used to refer to a painkiller include pain reliever, pain medication, pain remedy, pain reducer, pain suppressant, painkiller drug, painkiller capsule, painkiller tablet, painkiller medication, pain easing medication. Informal words for painkiller: pain buster, pain ease, pain meds, pain pill, pain relief, pain stopper, pain tabs, pain tamer. How many types of painkillers? Here's a brief overview of the main types of painkillers: nonsteroidal anti-inflammatory drugs, NSAIDs, reduce pain and inflammation. Examples include ibuprofen and aspirin. Acetaminophen, paracetamol, relieves mild to moderate pain and reduces fever. Opioids, strong pain relievers that work by binding to opioid receptors. Examples include morphine and oxycodone. Combination pain relievers, mix different types of painkillers for more effective relief. Topical pain relievers, applied directly to the skin for localized pain relief. Examples include lidocaine patches and menthol creams. Adjuvant medications, not primarily for pain but can enhance pain relief or manage specific types of pain. Examples include antidepressants and muscle relaxants. How do painkillers work? Overview of how different types of painkillers work. Nonsteroidal anti-inflammatory drugs, NSAIDs, reduce pain and inflammation by blocking enzymes that produce pain-inducing chemicals, called prostaglandins, in the body. Acetaminophen, paracetamol, alters pain perception in the brain by inhibiting the production of certain pain-signaling chemicals, without reducing inflammation. Opioids, bind to specific receptors in the brain and spinal cord to block pain signals and alter pain perception. Combination pain relievers, mix different types of painkillers to target multiple pathways for more comprehensive pain relief. Topical pain relievers, numb nerves or modify pain signals at the site of application, providing localized pain relief. Adjuvant medications, modify neurotransmitters or other mechanisms involved in pain processing, enhancing the effects of primary painkillers. What are the side effects of painkillers? Common side effects may include gastrointestinal issues such as stomach pain, ulcers, or bleeding, with NSAIDs and some opioids. Nausea, vomiting, or constipation, common with opioids. Drowsiness, dizziness, or lightheadedness, especially with opioids or certain combination pain relievers. Liver damage or toxicity, with excessive use of acetaminophen. Increased risk of bleeding or cardiovascular events, with long-term use of NSAIDs. Allergic reactions, such as skin rash or swelling of the face, lips, or throat. Dependency or addiction, particularly with opioids. Respiratory depression, a potentially serious side effect of high-dose opioids. It's important to note that not everyone will experience these side effects, and the severity can vary from person to person. Are painkillers addictive? Yes, certain painkillers, particularly opioids, can be addictive. How do opioids cause addiction? Opioids bind to specific receptors in the brain, leading to pain relief and sometimes euphoria. Over time, regular use can lead to physical dependence and tolerance, increasing the risk of addiction. What are the signs of opioid addiction? Signs include cravings, loss of control over drug use, and withdrawal symptoms when attempting to stop. How can I reduce the risk of addiction? Use opioids as directed by a healthcare professional, be aware of the signs of addiction, and seek help if needed. Can I take painkillers with other medications? Medications that can typically be taken with painkillers. Many common medications, including antibiotics, antacids, and most medications for chronic conditions like high blood pressure or diabetes, can usually be taken safely with painkillers. Medications that may have interactions with painkillers and should be used cautiously or avoided: blood thinners, for example, warfarin, aspirin, may increase the risk of bleeding when combined with certain painkillers, especially NSAIDs. Certain antidepressants, anti-anxiety medications, or antipsychotics may interact with opioids, increasing the risk of sedation or respiratory depression. Some medications for high blood pressure, for example, ACE inhibitors, beta blockers, may have reduced effectiveness when combined with NSAIDs. Alcohol should be avoided or used cautiously with painkillers, especially opioids, as it can increase the risk of respiratory depression and other adverse effects. It's essential to consult with a healthcare professional or pharmacist before combining any medications to ensure safety and effectiveness. What is the appropriate dosage of painkillers? The appropriate dosage of painkillers varies depending on factors such as the type and severity of pain, the individual's age, weight, and overall health. Here are some examples to illustrate the appropriate dosage of painkillers. Ibuprofen, for example, Advil, Motrin, for adults, 200 mg to 400 mg every 4 to 6 hours as needed, up to a maximum of 1,200 mg per day. For children aged 6 months to 12 years, dose based on weight, typically 5 to 10 mg/kg every 6 to 8 hours, up to a maximum of 40 mg/kg per day. Opioids, for example, oxycodone, hydrocodone. Dosage varies widely depending on the specific opioid, formulation, and individual factors such as tolerance and severity of pain. Generally, opioids are started at the lowest effective dose and adjusted based on the individual's response to treatment and the presence of side effects. How long can I take painkillers? For acute pain, such as pain following surgery or injury, painkillers are usually prescribed for a short duration until the pain subsides. For chronic pain, painkillers may be needed long-term, but healthcare professionals typically monitor usage closely to minimize the risk of dependence or other adverse effects. Why are some painkillers taken before a meal? Some painkillers, particularly nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen may cause stomach irritation. Taking them before meals creates a protective barrier, reducing direct contact with the stomach lining. Why are others taken after a meal? Other painkillers, such as certain opioids or acetaminophen, Tylenol, may not have as strong of an irritant effect on the stomach lining. After meals, they absorb slower, offering longer-lasting pain relief. Are there exceptions to these guidelines? Yes, individual responses to painkillers can vary, and some people may tolerate certain medications better on an empty stomach or with specific types of food. Additionally, extended-release formulations of certain painkillers may be designed to be taken with or without food, depending on the manufacturer's instructions. Do I have to take gastroprotective medication before taking painkillers? Whether you require gastroprotective medication before painkillers hinges on factors such as type of painkiller. Some painkillers, particularly nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or aspirin, are known to increase the risk of stomach irritation, ulcers, or bleeding, especially with long-term use or at high doses. Individual health status. Your health status, including any history of gastrointestinal issues such as ulcers or bleeding, as well as other medical conditions you may have, for example, kidney disease, liver disease, can influence whether gastroprotective medication is necessary. Risk factors. Certain risk factors can increase your likelihood of experiencing stomach irritation or ulcers when taking painkillers. These may include older age, a history of ulcers or gastrointestinal bleeding, concurrent use of other medications that increase stomach acid production, for example, corticosteroids, or heavy alcohol consumption. Can I take painkillers with tap water? Yes, you can typically take painkillers with tap water. However, if you have specific concerns about the quality or safety of your tap water, you may choose to use filtered or bottled water instead. Can I take painkillers with boiled water? Yes, you can take painkillers with boiled water. Boiled water is generally safe and neutral, making it a suitable option for taking medications. Can I take painkillers with milk? Yes, you can usually take painkillers with milk. Milk may help soothe the stomach and reduce the risk of gastrointestinal irritation, particularly with NSAIDs like ibuprofen. Can I take painkillers with orange juice? It's generally safe to take painkillers with orange juice. However, some painkillers, particularly NSAIDs like ibuprofen, may irritate the stomach lining, and acidic drinks like orange juice could potentially exacerbate this irritation for some individuals. Can I take painkillers with lemonade? Yes, you can typically take painkillers with lemonade. However, be cautious with acidic drinks like lemonade, as they may potentially irritate the stomach lining. Can I take painkillers with hot chocolate? Yes, you can typically take painkillers with hot chocolate. However, it's essential to avoid adding excessive amounts of caffeine or sugar, as these may interact with certain painkillers or exacerbate side effects. Can I take painkillers with tea? Yes, you can usually take painkillers with tea. However, some painkillers, especially those containing caffeine, like some headache medications, may interact with the caffeine in tea, potentially increasing nervousness or sleep disturbances. Can I take painkillers with coffee, including cappuccino? Yes, you can generally take painkillers with coffee, including cappuccino. However, be cautious with caffeine, as it may interact with certain painkillers or exacerbate side effects. Can I take painkillers with soda? Yes, you can typically take painkillers with soda, but it's essential to choose non-caffeinated options, as caffeine can interact with some painkillers and potentially worsen side effects such as nervousness or sleep disturbances. Can I take painkillers with Coke? It's generally not recommended to take painkillers with Coke or any carbonated beverages. The carbonation in Coke can potentially irritate the stomach lining and may exacerbate gastrointestinal side effects, especially with medications like NSAIDs. Can I take painkillers with wine? It's generally not recommended to take painkillers with alcohol, including wine. Alcohol can increase the risk of side effects such as drowsiness, dizziness, or liver damage, particularly when combined with certain painkillers, such as opioids or acetaminophen. Is there a difference in the timing of painkiller intake? Yes, timing can impact both the effectiveness and side effects of painkillers. Taking painkillers in the morning can offer relief during daytime activities but may cause daytime drowsiness. Evening or nighttime doses can assist in managing pain for improved sleep, although they may contribute to morning grogginess. If painkillers are finished but the pain persists, what should I do? If pain continues after finishing painkillers, consider alternative pain management methods or consult a doctor for further evaluation. Can I take more painkillers if the pain persists? Avoid taking more painkillers without consulting a doctor first. Taking additional painkillers may not address the underlying cause of the pain and could lead to side effects or complications. Why do some painkiller pills have unique shapes or designs? Painkiller shapes or designs serve to 1. Easily identify them, 2. Prevent medication mix-ups, 3. Facilitate swallowing, 4. Control medication release. Is there any significance to the color on painkiller pills? White painkiller pills may be commonly associated with over-the-counter medications like acetaminophen, Tylenol, or ibuprofen, Advil. They may also indicate generic versions of painkillers or lower-dose formulations. White pills are often chosen for their neutral appearance and ease of identification. Yellow painkiller pills may indicate specific formulations or brands of painkillers. They may also be used for extended-release formulations or higher-dose medications. Yellow pills may be chosen for their distinct appearance to differentiate them from other medications. Blue painkiller pills may be used for certain brands or formulations of painkillers. They may also indicate specific dosages or combinations of active ingredients. Blue pills may be selected for their calming or soothing connotations. Red painkiller pills may be used for specific formulations or brands, often indicating higher doses or extended-release versions. They may also be chosen for their distinct appearance or to evoke a sense of urgency, for example, for severe pain. Red pills may also be associated with warning or caution, indicating potential risks or interactions. Orange painkiller pills may indicate specific formulations, dosages, or brands of painkillers. They may be chosen for their distinct appearance or to signify a middle ground between lower and higher doses. Orange pills may also be associated with energy or vitality, although this is not necessarily a factor in painkiller selection. Are there any alternatives to painkillers? Physical therapy. Physical therapy involves stretches and manual techniques to improve mobility, strength, and function, which can help alleviate pain, especially in musculoskeletal conditions. Exercise. Exercise, such as walking, swimming, or yoga, can help reduce pain and improve overall health by strengthening muscles, improving flexibility, and releasing endorphins, the body's natural painkillers. Cognitive behavioral therapy, CBT. CBT is a type of psychotherapy that focuses on changing negative thought patterns and behaviors associated with pain. It can help individuals develop coping strategies, relaxation techniques, and stress management skills to better manage chronic pain. Heat or cold therapy. Heat therapy, such as warm baths or heating pads, can relax muscles and improve blood flow. While cold therapy, such as ice packs or cold compresses, can numb the area and reduce swelling. Acupuncture. Acupuncture is a Chinese technique where thin needles are inserted into body points. It stimulates healing, reduces pain, and induces relaxation. Chiropractic care. Chiropractic adjustments and manipulations can help realign the spine and joints, reduce nerve compression, and alleviate pain, particularly in conditions such as back pain or neck pain. Massage therapy. Massage therapy manipulates soft tissues to relieve tension, improve circulation, and promote relaxation. It reduces pain and enhances overall well-being. Mindfulness and relaxation. Mindfulness-based practices, such as meditation, deep breathing exercises, and progressive muscle relaxation, can help reduce stress and improve pain tolerance. By promoting relaxation and acceptance of pain sensations, depending on individual needs and preferences, these methods can either work together with painkillers, complement, or be used instead of painkillers, substitute. Certain methods may be more effective for different types or levels of pain.